Good morning, guys. Just before I go to work, I just thought of recording something for you guys. I think this is my fifth video on this channel. You remember last time I mentioned to you about the doctors, sort of different categories of doctors in Victoria, or like different types of medical officers. Today, I'm going to take the topics to Queensland. So there's a different structure in Queensland. So I'm going to discuss about how's the different doctors named according to their, like postgraduate year of practice. So without further delay, we'll just go into the discussion, but I'll share the screen and then go from there. Okay, now you can see my desktop. Here, this is the website if you want to go and check it. Like it's the healthqid.gov.au. In that, you can get these different categories. Let's go through. So this is the clinical career structure, as they describe as it is. Clinical career structure in Queensland, which is a bit different to Victoria, as you can understand when I go through. Once like a medical students finish their university, like once they become like qualified after their exams, final exams, they become postgraduate year one. Just like in Victoria, we call them interns or PGY1. The postgraduate year one people in Queensland, they call they actually give a name RMOs. I'll just go into a bit of a detail here. So postgraduate year one, which is intern, and postgraduate year two, which also called junior house officers, and then the postgraduate year three called senior house officers. So interns, junior house officers, and senior house officers, or like the first year after the graduation, second year, and third year, they all given a similar category as RMOs. Okay, so in Queensland, RMO means either an intern or postgraduate year two or postgraduate year three, or intern, junior house officer, or senior house officer. So that's a bit different to Victoria, for instance. If you go back to my previous video on Victorian categories, Victoria interns just call intern, and then postgraduate year 2, 3, they call like the hospital medical officers or HMOs. So HMOs and interns together, they call RMOs in Queensland. Okay. Then as you go up on the ladder in Queensland setting, like for instance, after the postgraduate year 4, they are known as PHOs. Yeah, they call principal house officers. So if you apply for a job from Sri Lanka or India or Pakistan or somewhere, and then if you're applying for a PHO job, for instance, you'll have to understand they expect you to function as like a postgraduate year 4 person, like quite sort of experienced. So that's what it meant by the principal house officer or postgraduate year 4 and above, the 4, 5, 6, and so on. And it's the same time the doctors go into the registrar training program in Queensland. So they call registrar in training, or like a registrar. So registrars in Queensland are actually postgraduate year 4 doctors. Let's go into a bit of a detail here. Here, interns means a medical practitioner who hold a practicing certificate from the AMC or APRA. And then they do a first year of practice immediately after the university, which is universal, like internship in India is the same, and Sri Lanka is the same, everywhere it's the same. And then the junior house officers, or JHO, are the second year postgraduate, or JHO is a medical practitioner in the first year service after full registration. I'll clarify a little bit here. To get to your full registration in Australia, you have to do a full year of clinical rotations. I think I mentioned this elsewhere, like surgery, medicine, pediatrics, and emergency. So the interns who complete this apply for APRA for the full registration. It's very similar to the like the international medical graduates or IMGs who coming here. So they have to do this first year of clinical equivalent of 1 year of clinical rotations, either in Queensland, Victoria, Tasmania, Western Australia, anywhere. And they then eligible to become the fully registered doctor in Australia under APRA, but they should also pass their AMC Part 2, or they should pass workplace-based assessment, one of them. So then they become junior house officers, or JHOs. Then senior house officer in Queensland is the third postgraduate year. They call SHOs, just like in Sri Lanka, we got SHOs. SHO is a medical practitioner in the second or subsequent year of practice experience after eligibility for full registration. So you can be a SHO even in third and fourth years. So these are actually RMOs, or resident medical officers. Who are the RMOs, or resident medical officers? Intern, junior house officer, senior house officer. So they all come under one umbrella of term, like resident medical officers. Then you get these PHOs, or principal house officers. They are the third and subsequent postgraduate year, like from the fourth year, who has like 4 years of experience as a doctor in hospital setting. And they're not undertaking any course, like, they're not doing any registrar work, like they are not registrars, but they're not in a training program, for instance, like they're not in emergency medicine training for emergency department. If you are a principal house officer or PHO in emergency, they work equivalent to a registrar's level, but they're not registrars. Okay. And then registrar, they are again the postgraduate year 4 and above, and they are actually in an accredited course of training. Like, they may be GP training, GP registrars, or they may be emergency training, emergency medicine registrars, or they may be in like anesthesia, surgery, BPT training, or basic physician training, or anything like that. Then as the patient get experienced, they become a senior registrar, the registrar pathway people, trainee people, and then they become provisional fellows. Finally, they become specialists in their practice. So what are the specialties? They could be specialist in any practice, like, private practice, government practice. They may be specialists like physicians, surgeons, emergency physicians, anesthetists, or anything like that. Or they become general practitioners. So they may be specialized in general practice, or they would be like a hospital staff, like a specialist staff. So those guys, if they're practicing in a private hospital as a specialist, or if a GP practicing or GP sort of looking after patients in a hospital, like if the GP is looking after a medical ward, surgical ward, or emergency department, They known as VMOs, right? Visiting medical officers. Or the other guys who working in hospitals, they could be general practitioners or staff specialists, or the other people called career medical officers, career hospital doctor. Like they have not done any training, like a formal training, but experience, and then they become SMOs, senior medical officers. Yeah. So senior medical officers could be general practitioners, specialist, like a emergency specialist, like emergency physician, or they could be career hospital doctors. Then, it's talk about Queensland Health, talk about international medical graduates who are offered staff positions and things. I don't go into a lot of details here, but you can follow the link and discuss here. Visiting medical officers could be either specialist of their own practice, or it could be like the general practitioners. Because I have worked in, this is in Victorian experience, I have worked in hospitals in my training, like the district hospitals and other rural hospitals and different other places, actually run by VMOs, visiting medical officers. They are GPs, general practitioners, who got interest in emergency, or who got interest in medicine, surgery, things like that. So surgical wards were looked after by GP surgeons. Emergency was looked after by GPs who got experience in emergency, and then medicine by GPs, like fellow GPs, fellowship holders. So you will see the difference. It's not like a GP in Sri Lanka, for instance, which is my experience, which is what I know from because I'm a Sri Lankan medical graduate. The GPs in Australia, here the Queensland for that matter, or even Victoria, they could act as like a kind of a specialist or visiting medical officers to looking after the wards and looking after emergency department. For instance, I can give you examples of those two hospitals. Echuca Regional Health, which is about 100 kilometers from here, maybe 150 to 100 from Melbourne. And that's run by the VMOs, visiting medical officers, or GPs with special interest with emergency department and medical management. So it's a hospital run by visiting medical officers or GPs. And then there's another hospital, Swan Hill District Health, which is again run by these kind of SMOs. It got the emergency department run by the career hospital doctors and staff specialists, like the emergency physicians, and also general practitioners. Yeah, so if you find most of the emergency departments in Australia, like even in Bendigo Health, there are some GPs or some VMOs still working there as like working a consultant's role, or looking after the hospital, or giving supervisory roles. So like an experienced GP or qualified GP would work as a visiting medical officer or VMO. Okay, just to summarize, Queensland Health, this is the clinical career structure in summary. Like from the university, first year, second year, third year, after the university, they are resident medical officers or RMOs. They're not in a special training program, but they're going up in the ladder with the experience, hospital experience. So postgraduate year 1, intern, postgraduate year 2, junior house officer, postgraduate year 3, senior house officer. All of them are known as resident medical officers or RMOs. And then the postgraduate year 4 and above, They could be either in an accredited training program or like a specialist training pathway. Then they're known as registrars. But if you're not in a specialist like training pathway, you will be known as a PHO, Principal House Officer. And then once they, like a registrars could be, as I said, GP registrars, emergency registrars, medical registrar, surgical registrar, anesthetic, yeah, like whatever the subspecialty. And then they can either become VMOs or SMOs. VMOs are visiting medical officers, and SMOs, senior medical officers. They could be like work as giving work as a like specialist. SMOs could be, like as I said, non-specialist or specialist, either way. Like they could be like a trained emergency physicians, or they could be GPs with emergency training. Okay, I think that clarifies the structure a little bit, and then I'll stop share, but I'll give a link to this site so that you guys can go through and find out more about Queensland medical career structure. Yeah, so I think you got some idea about the Queensland Health career structure. In my previous video, I was talking a bit about the Victorian structure. In near future, I will cover like, Tasmania, Western Australia, and South Australia, and so on, so that when you guys apply for jobs from your own country, say from Sri Lanka, India, Pakistan, your structure may be different. This is a bit complicated structure in Queensland. Your clinical career structure is different. For instance, I'll bring up the Sri Lankan experience. Sri Lanka, you become intern first year, first postgraduate year, and then you will be known as a SHO, Senior House Officer. Unless you're in a specific training pathway as a registrar, you will be a SHO forever. Okay, and in Sri Lankan setting, GPs won't look after hospitals, and Sri Lankan settings, GPs, I think they got a fellowship program now, but GPs not acting as VMOs, for example. But here, not only in Queensland, Victoria, Tasmania, Western Australia, everywhere, GPs could act as VMOs if they like. For instance, if we like, we can go back to the hospital a little bit and then do the clinic a bit that way. Okay, I think you got some idea about the structure of Queensland Health. I think it's helpful for you guys. If you have any questions, please post them under here, and then I'll talk a bit more about other states in the time to come. Thank you.